pleasure to meet you. I'm Dr. Murmurs, and today I'll be conducting a very thorough cranial nerve examination. Alright, I need to take some details first before we begin. Please, can you confirm your first name? Your first line of address. And your post or zip code. And your telephone number. Great. Okay. Just put these up here for now. Just need them for reading, you see. I can never get them onto my head. There we are. Now, I just want to have a quick understanding of why you're here today. Alright. Well, we'll conduct a full cranial nerve examination. And I'm sure we'll find that there's not a problem, but we'll definitely look into those symptoms that you're describing there. Alright, so how this works is we're going to go through different tests for all 12 cranial nerves to make sure that they're functioning correctly. I have a checklist here to make sure that we sign you off with. I'm sure it'll be 12 out of 12 for each different test. Now, are you comfortable? Just having a quick look here. Okay, I'm just going to move this slightly in there. Okay. If we just slightly move your headrest a bit there. Is that better? Yeah. Okay, so you're... Yeah. Alright, okay. I'm just going to pop some gloves on before we proceed, of course. Alright, so our first test today is that we're going to be looking at your smell, so your olfactory nerve, cranial nerve number 1. Alright, so I have 5 different scents that I would like you to smell, and all you need to do is just let me know what you think they are. If you don't know what it is, just describe the scent to me, okay? Great. Begin with this. Okay, I'm just going to check myself. Yep, smells quite strongly, so I'm just going to gently push this over here. Just breathe in deeply. What do you smell? Try to smell that again. Are you sure? Yeah, just one more time. Can you describe the scent to me? Okay. Well, this scent is cinnamon. Yeah, it's definitely cinnamon. Yep, strong cinnamon. There's no hint of lemon in there. Are you sure you could smell lemon? Very citrus scents. Alright, okay. Let me just note that down. Let me try this one then. And just smell that. Yep, okay. What does that smell of? You sure? Nothing at all? That's interesting. So you can't smell anything from this one. Well, this is actually lemon. So you can't smell anything. Alright, okay. I'll just note that down. Okay, let's try something different. What about this one here? It is quite a common smell. So just breathe in and out. Yep. Alright. What does that smell of? Smell again. Okay. Well, it's not. I mean, I can see maybe where you're going to, but it's not spicy. So you smell like a kind of rosemary, like a lamb chop smell. This was actually lavender. Yeah, it is a little bit herby, but not quite. I think your brain's getting a little bit confused, perhaps, of what you're smelling here. Maybe the signals are just not quite sending the message to your brain. Okay, let's try another one. Okay, this one is a very unique scent. Yep, okay, I'm just going to... Okay, what do you think that smells like? Try again. We'll just keep it fine. Don't worry about it. We're just gonna keep trying so we can figure this out. So you think that smells like tar? Like road surfacing tar? Very unpleasant. Okay, well that was actually peppermint. Oh, excuse me, I think that was one of the doctors next door. They're so loud with their sneezing. Anyway, peppermint. Alright, okay. And finally, let's just have a quick try this one out. Maybe this will be the one you get right. Okay, what does this smell like? Are you sure? No, it's not rose water. No. It's actually tea tree. And tea tree is very, very strong. Alright, well, we're going to have to look a little bit further into that. So that was cranial number 1. Okay. So we're just going to put a little bit of a cross beside that on your checklist because we need to look into your cranial nerves, okay? Right. Now, we're going to do cranial nerve number 2, which is your optic nerve. And your optic nerve does everything, almost everything, with your eyesight, okay? So our first test is we're going to do the Snellen chart. I'm sure you'll have seen them before. My Snellen chart is slightly different. So, because we don't have a lot of room to have up here, I have this. I'm going to hold this. Here is approximately where we're going to use this today. It's the right distance for the size. It's been scaled down. Okay, can you please read to me what the first letter is? The next line. Yeah, and the next line. Okay, next line. What's the last letter again on that one? Okay, and the next line. Can you get any on that line? Yeah? What about that letter here? And this letter here? Anything on the... No? Anything down? You sure? Okay. Do you normally use glasses if you've not got them on today? No. Okay. Alright. And do I look clear to you? Okay. Right. Okay, well, we're going to now do the visual fields test, alright? So that is, I'm going to use this beautiful little pen here that I got. There's a torch. I love it because it's pink and I just love pink. We're going to use this today, and I'm going to bring my hands into your visual field, and you just need to let me know when you can see my fingers. Okay. Okay, so we're going to start with this eye here, your left eye. Alright. Yep. Okay. 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 Okay, do it again. Remember, as soon as you see it, just let me know. Okay. Right, we're just going to try your other eye now as well. Okay, so just let me know when you can see it. You see it? There, okay. Okay. Alright, okay. Right. Interesting. Interesting indeed. Not to worry, we will discuss this at the end of this examination, of course. Now we're just going to do some from the blind test here. So I'm just going to find this here. I want you to just let me know if you can see the number in this. Can you see the number? Anything at all? What about this? On this side, can you see anything? At the other side? Just keep focusing. Okay, let me try another one. Okay. Can you see a letter? This might be easier. A letter on this. Can you see a letter? Let me know what letter you can see. Okay. Anything at all? Let me see if there's a slightly different colour. What? Can you see a shape? And if so, describe it to me. What shape is on this one? So just have a good look. What can you see on that? Okay. Right, well, we're going to move on to cranial nerves number 3, 4, and 5. They're again all associated with your eyes and movement, but in particular your pupil movement and also the movement of your eyes. So we have a couple of tests to do for this one, alright? So we're going to do the light reflex. So I'm going to cover one of your eyes and I'm going to shine in to your eyes with this torch. Okay. And I'm going to look at your pupils when I bring it in close and when I have it out far. Alright, so we're just going to cover your right eye like this. I'm just going to bring this out here. I'm just going to bring this closer and then push it away. And then closer and away. and away. Again, and away. I'm going to do the other eye now. I'm just going to cover your left eye. Here. And then we're just going to bring that in. I'm going to push it away. And I want to come in, and then put it away. And then in, and then put it away. Again. Okay. Let's put them both uncovered. Okay. Okay, can you please focus on this finger? Alright. I'm going to focus on this finger, and I'm going to bring it all the way in really close and back out again, alright? So just focus. There, and all the way back out. And then focus. Keep on there. Sit. This side, okay, focus. All the way in. And out. And in. Can you just now look up for me? So we're going to do your left eye first, so I'm just going to cover this. So look up for me. And down. To the left. And to the right. And up. And down. To the left. And to the right. Okay. And on the other side, look up and look down, look to the right and to the left and up, down, to the right and to the left. Okay. Okay, so that was 3, 4, and 6. We're going to now move on to cranial nerve number 5, which is all about the sensations. So you'll be looking forward to not doing anything with your eyes. You can rest them a little bit for a while. Yeah, there were a couple of things that we'll maybe discuss at the end that were a little bit different to what I was expecting, you see. So what did you say happened to you again? Okay, let's continue. You still do know. Right, well, we'll get this set up for the next test. So this is the sensory test. We're going to be doing a pain, it's not very painful, and soft, alright? What would you like me to do first? You can choose, so it will be around your face, and we will have either this very soft touch. You need to let me know when you can feel it. And we also have this very gentle prick. See? Just slightly sharp enough to trigger your pain focus neurons. Alright. Okay, we'll go for the prick first, that's fine. Okay, just relax for me. Just let me know when you can feel this. You feel that? How about now? Okay. What about up here? Can you feel it? What about if I push it like this? Not at all. I don't think any stronger in that one. Let me try. About this? No. Okay. What about down here? Yeah. This down here. Yeah. Feel that straight away. That's good. Okay. Let me go back up to here then. Let me try it up this bit. You feel that? Mm-hmm. Great. Okay. Put it down here. You don't feel that? Okay, we'll put here. Harder. Feel that at all? You feel when I touch? Not really. Okay. Put it down here. Yep. In there. Okay, and around here. Alright. Interesting. Now we're also going to look at motor function here with this cranial nerve number 5. And all I want you to do is take a gulp, just swallow for me, and I'm just going to observe. Yep, just swallow, just go and gulp. Are you able to do that again? And gulp. Just gonna assess your facial symmetry at rest now. I did notice you just slightly in this corner of your mouth here slightly. Does it normally do that? It slightly droops. No? Okay. Right. Okay. Okay, well, I'm going to ask you to do some different faces or expressions for me, okay? So I can assess your muscles. Okay, so this is resting. Can you please do a big cheesy grin for me? On this side as well. Okay. Can you raise your eyebrows for me? Nice and high. Can you scrunch your eyebrows like this? Can you raise it nice like this? Okay, can you do this with your mouth? Blow your teeth out. Okay, can you stick out your tongue? Okay, I'm not closer into your tongue in a moment. But we're going to move on to cranial nerve number 7. I think it's number 7. Yes. No, that was number 7. Sorry, we're going to look at cranial nerve number 8. Cranial nerve number 8 is to do with your hearing. Okay. So we've got a couple of different tests we're going to do for your hearing. Now the first one we're going to do is we're going to do the distraction test. So I'm going to whisper in one of your ears and make a distraction in the other, and I want you to tell me what it is I said. Okay, so I'm going to come up nice and close for this. Hello. Plant. Spring. Midnight. Cape Verde. Okay. Yeah, a couple of them you struggled with there. Okay, so I'm going to then do this, I think, because... Yep. Let's do this. I'm just going to use the tuning fork to assess your sound. So I want you to let me know if you can hear this and when you stop hearing it, okay? So. I want to move on and actually have a look at your reflexes. So we're going to use this little device. I'm going to hit this in your knee, just underneath your knee, to look at your reflex with your feet and your legs. Alright, I'm going to do this now, so just do this leg. And the other one. Go back to this one. And the other one. Okay. Can I ask you to try and cough for me? Just cough. Okay. I'm just going to have a quick look. If you can open your mouth into the back of your mouth there, okay? Just open up wide. Yeah. Okay. Just look at your palate. Put it back in there, thank you. Now I'm going to put my hand like this on your face, and I want you to turn your head and push against my hand, okay? So just do this, okay, and push. Okay. Try again with more force. Push. Okay. And that's quite weak. And now the other side. Push. Try. Push. Push. Is that all you've got? Come on, push, push, push. No. Okay. What about if I put my hands here on your traps? I want you to try and shrug your shoulders against my resistance, okay? So that's a shrug your shoulders. Push, 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 push. Okay, and try again. Push, 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 push. Alright. And finally, we're just going to have a look at your tongue. So if you can open wide and sit your tongue out for me. So just going to look in for any ways. Can you move your tongue side to side for me? Yeah, this way. Okay. Okay. Well, I think what we're going to do is I'm going to need to refer you now to a neurologist who'll be able to do some MRI scans and CT scans to determine where the issues are with your cranial nerves. So let me run down for you. So your sense of smell is disrupted. You are smelling different scents to the ones I'm giving you, and also not smelling some at all, which suggests that there is an issue with your cranial nerve 1. Your visual acuity is much more reduced, and your visual fields is very narrow, much more narrow than we would expect in the average person, so that needs to be assessed. Your movement of your eyes was okay. I wasn't best pleased with the focusing, but it was okay. Then we have the touch. You seem to have some nerve loss of sensation around your forehead and down your left cheek there. And your symmetry is fine. Your facial expression, again, lost slightly in the corner of your mouth on that left side. Your hearing was not what I would have expected with your age and fitness. And also your sternocleidomastoid assessment was you're very weak to your right side. So I think, yep, we're going to refer you to a neurologist who's going to take a closer look at you. But you were right to come in today, so thank you very much for coming in. And I wish you all the best in the future. Okay, and we'll get that sorted for you.